surgery versus cosmetic surgery. What's the difference between them? This is the first misconception that we'd like to clarify today. It takes me great pleasure to be welcoming my guest, Dr. Fatima Al-Subhi, consultant plastic surgeon. Welcome to Ladies Hour.
Thank you very much.
What's the difference between the plastic surgeon and the cosmetic surgeon?
So, the cosmetic surgeon is the surgeon who's usually doing only cosmetic surgeries, while the plastic surgeon does the cosmetic surgery plus to that any reconstructive surgery. So,
give me examples, please.
So, for example, if you're taking the nose, so you can do rhinoplasty, which is a cosmetic procedure, while nasal reconstruction is a reconstructive procedure. In rhinoplasty, you are just changing the shape of a normal nose. It could be just, disfigured by small anomalies or abnormalities like its humpy nose or long nose or this bulbous tip. So rhinoplasty, you are changing the shape by improving, this deformity. While reconstructive surgery, when there is a deformity, it's not normal. It looks abnormal. Either it is coming from congenital anomaly or it's coming from trauma or oncological, for example, resection in the nose. So when you are doing reconstruction, you are, rebuilding the nose again to look normal.
Yeah, but of course they are both physicians.
Yes, both of them are surgeons, and it's exchangeable terms. So the plastic surgeon can be a cosmetic surgeon because he's doing cosmetic and reconstructive. But when you are saying this a cosmetic surgeon, that means he's only a surgeon does cosmetic surgery only.
Mm-hmm. Means that if the patient is going to go more under the knife, this requires a plastic surgeon, not cosmetic one.
Yeah. If you are saying cosmetic surgeon, it's different from cosmetic physician. Yeah. Because cosmetic physicians, they cannot be a surgeon, so they can be a GP or dermatology, but they are interested or specialized in doing cosmetic surgery. Yeah. While when you are saying a surgeon, that means he is, trained and qualified to be a plastic surgeon, but he is specialized more in cosmetic and aesthetic surgery.
Yeah. There are a lot of procedures that we know that some of them are surgical and some are not. Surgical operations in plastic surgery. Right. There are non-surgical operations and there are surgical operations. What are the most common in both types?
So you are talking any cosmetic procedure and surgical operations. Yes. So in cosmetic procedure, I would say Botox and injections, the fillers, are the most common things that can be done.
What's the difference between Botox and
So the Botox is a material injected to paralyze the muscle. It's a block an area which is called the neuromuscular nodes, which block the muscles, so it changes the animation of the face. So if you have a frown lines or deep wrinkles and it's caused by the strong contraction of that muscle, so you inject the Botox in that muscle to weaken the muscle and decrease the lines, which is, for example, the frown lines. That's what we do most of the time for the Botox. Yeah. Fillers, it's a material you fill. So it just you put it under the skin to fill either fine lines or deep lines, and sometimes to improve the volume. For example, cheek fillers, you are injecting more volume and some substance to enhance and augment the cheek.
More to talk about this, but we're having a report and we'll be back. Please stay tuned.